Hi guys, this is Dr. Prateik Poddar. So very interestingly, today I got a patient who came with abdominal pain. So there was a pain right in the epigastric region, just where the chest meets the abdomen. And he was a young chap, around maybe say a 35-year-old young guy, and he was having pain for the past 2 months. Every time after meals, he was complaining of this pain. It was disturbing his sleep, disturbing his activities. It was very difficult for him to focus on his work in his office. So finally, he landed down with me, and looking at his history, discussing with him, I suspected that there might be some peptic ulcer going on. And lo and behold, when we did the endoscopy, we find few ulcers in the stomach. Now, whenever we think of ulcers, people get very scared. Are we dealing with a cancer? Are we dealing with a big problem? What is happening? Why did I get this ulcer? Well, it's nothing to be afraid about. Peptic ulcer is actually quite common. It happens. There are a lot of causes, some very well known and some not so well known, I would say. But the main things are that some people are prone to peptic ulcers. The most common and the most important cause would be an infection. So when we did the endoscopy for this patient, and the endoscopy we did was a 1 to 2 minute procedure. It just takes, we put a local spray, we put in the scope, and within 2 minutes we are out. And we found the ulcers, and we also took a test for something called the H. pylori bacteria, Helicobacter pylori. Now this bacteria is a very interesting bacteria. It's been known for years now, and the main thing is it is spread through food and water. Now once it enters the body, it gets colonized in the stomach and it causes ulcers, and that is the most common cause of ulcers right now in the world. Apart from that, of course, you have painkillers which can cause ulcers. You are using blood thinners which can cause ulcers, and so on and so forth. Of course, cancers are a very important cause of ulcer, but if you look at 100 patients of peptic ulcer, only one would have a cancer. So it's nothing to be scared about. So this young chap, he was actually having the H. pylori infection. So we took a rapid test during the endoscopy, and the rapid test came to be positive. And once the test is positive, it's like a kit. I'll show you next time. It's a yellow kit, and it turns pink as soon as the patient has the H. pylori infection. So once it turned pink, we knew the patient was having an infection. He took a 2-week course of antibiotics, and glad to say, so when this patient will improve gradually with this 2-week course of antibiotics and with the painkillers, the antacids that we give the patient. So we've used something called the proton pump inhibitors. They basically heal the ulcers and by preventing the gastric acidity. So we started the patient on the therapy from today, and the patient should respond well. And we get these patients very often. It's very importantly to understand we should not take painkillers unless there is a strong indication for painkillers, because painkillers are one of the very important causes of peptic ulcer. Whenever you are having a peptic ulcer like symptom, or the doctor advises endoscopy, when you do the endoscopy, remember it's a painless test, and when we put in the scope, we do a rapid test called the rapid urease test. If it's positive, you have an infection, and we can treat you completely and you'll be fine. So, and we don't always need biopsies as well. So even with patients who are having peptic ulcers, it's nothing to be scared about. You can be free of the disease very quickly and you're back to work in a jiffy. Thank you.